welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about how oral inhalation flecainide may help restore the sinus rhythm in atrial fibrillation patients. Atrial fibrillation, often called as an afib, is the most common type of treated heart arrhythmias. And arrhythmia is when the heart beats too slowly or too fast, or rather in an irregular way. When a person has afib, the normal beating in the upper chambers of the heart, which is the two atria, is irregular and the blood doesn't flow as well as it should from the atria to the lower chambers, that is the ventricles. Now, afib may happen in brief episodes or it may be a permanent condition. Currently, oral and intravenous flecainide is recommended for cardioversion of atrial fibrillation. The study that I'm talking about aimed to evaluate the feasibility of delivering flecainide via the oral inhalation route for acute conversion in an open-label dose escalation study. The researchers wherein they hypothesized the fact that delivery of flecainide by oral inhalation would quickly reach the plasma concentration levels sufficient enough for restoring the sinus rhythm in patients with a recent onset of atrial fibrillation. It was found that the conversion rates did increase with dosage with the maximum plasma concentrations of flecainide. At the highest dose, 48% of patients converted to sinus rhythm within 90 minutes from the start of inhalation. And among patients who achieved a maximum plasma concentration, the conversion rate within 90 minutes was 50%. And for those who achieved a maximum plasma concentration, it was found to be 24%. The researchers then concluded that administration of flecainide via an oral inhalation route was shown to be safe and yielded plasma concentrations of flecainide was sufficient to restore the sinus rhythm in patients who've had a recent episode of atrial fibrillation. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.